Hello and welcome to Health Bytes. Health Bytes is brought to you by the Public Health Unit of the Ministry of Health and Social Development. I'm your host, Public Health Communications Specialist Natasha Letom Humphrey. Here, returning on our program today, we have our Chief of Drugs and Pharmaceutical Services, Mrs. Gracia Wheatley Smith, here to talk about antimicrobials. Welcome to the program, Mrs. Smith.
Thank you, Mrs. Humphrey. Happy to be here.
Always a pleasure bringing you on here. We learn a lot from you. And, we're seeing you in your antimicrobial shirt, and I've seen a few around town recently. Tell us a little bit about your branding.
Oh, our branding is to support the global thing that antibiotics, antimicrobials, antifungals, we do get resistance to them, and that will pose a problem for us in the future. So hence we need to take care of them, prescribe them properly, take them properly, and just deal with them properly. Don't misuse them, don't abuse them, because we need them.
Lovely. Handle with care, ladies and gentlemen, when you're dealing with antimicrobials. So start us off. What is a microbe?
A microbe actually is a small little form, life, that you can't see with your eyes, would have to be seen under a microscope. There are good microbes and there are bad microbes. And the one that desire treatment are the bad microbes. And they can actually be bad for us, that can lead to death. So we need the antimicrobials to treat them effectively. But then it is up to us how we use them. Can see results or cannot see results.
Okay, we need the antimicrobials. So what do the antimicrobials do in relation to the microbes?
The antimicrobials, such as our antibiotics, is 5 classes. So we have our antibiotics, we have our antivirals. So our antibiotics kill bacteria and our antivirals kill our viruses. Our antifungals kill our fungus infections, and our antiparasitics kill the parasites that we may ingest or that we may pick up along the way. Now they work in many different ways according to the class. So antibiotics can kill the bacteria, or it can just create an environment where the bacteria cannot thrive, and therefore it eventually dies itself.
Mm-hmm. Okay, so now we had the microbes, we had the antimicrobials. Now we have to talk about antimicrobial resistance. How do we get to that level?
Okay, sometimes we are our own worst enemy, because we misuse and we abuse something once we find that it is good. Now, life is always about a balance. So even in prescribing and taking antibiotics, it must be done properly and it must be done rationally. Okay, so antimicrobial resistance is basically where microbes stop responding to the medicine that you take in order to get yourself better. So although you may find that you go to the doctor for a particular infection, and he may give you a prescription, you go to the pharmacist and you fill it and you take it, and you do not see any improvement. And the first thing you may say is, "Oh my gosh, this doctor does not know what he's doing, because I'm not getting any better." It could be a case where you have microbes in your body. So it is not you, the person, who becomes resistant. We must note that it is the microorganism that is in your body that becomes resistant. So it may be a case where you have taken that antibiotic so long, so many times in the past, for the wrong problem, that the microbes in your body have developed resistance to that same antibiotic that a doctor prescribed. So now here, the microbes are getting stronger and stronger and stronger because of misuse and abuse of the antibiotics. So when you now get this antibiotic, say years later, it is no longer effective. Mm-hmm. So we have a problem, because then what are you going to use?
So how would you figure out if you have developed a resistance?
Well, you cannot figure that out. You may see, because like I said, you may have gone to the doctor and you are not getting better, and he has used it. But then if you continue going, the only way that can be figured out is through a laboratory culture sensitivity test, where they use the disc that has the medicine in it. So it's a little small disc that you would place in a culture plate that has a medium in it with your organism that they took from you. And then that is placed in an appropriate environment for a couple of hours, and then they take it out and they read it. Now, when they read it, so they'll put different antibiotic discs in it. So one may have, let's say, penicillin, one may have ceftazidime, one may have zinocef, and all of those to see which one the organism is sensitive to, since you've been sick for so long. And what would happen if the organism is sensitive to one? You would see that around that disc becomes clear, and the diameter around it also becomes larger. If it is not sensitive, that one disc, there would be no difference around the medium in that. So, and then when they read it, they will measure it and say, okay, so the organism is sensitive to A, B, and C, but I did not see a change in D, so that means it is resistant to that medication. So it's through laboratory testing that resistance is found.
What I found interesting with what you said originally that causes the resistance to happen, you said using, the wrong set of antimicrobials for the wrong reason over a period of time. But if we're talking about prescription medication, we're getting those prescriptions from our doctors. So how do we, as prospective clients and persons who are aware of this fight and want to do our part, how do we know that we're being prescribed the right antimicrobials for the right illnesses that we have?
That's where studying and learning and keeping current with changing information for medicines comes in. So your doctor would be the only one, because they will actually go through with you and determine what it is that you have become infected with, and then decide to write a prescription. So you yourself will not know this. Your pharmacist will not know this. Of course, we have a knowledge of it, but we have not sat with you and know what you're experiencing and done any lab tests to know definitively, well, this is that. And that is why pharmacists should not dispense medicines, antimicrobials, without a prescription for the doctor, because the doctor is the one who have done the lab tests and so forth and gotten those results. Now, if you know that you have been taking medication and you become resistant to it, you should have that record and say, well, doc, when in the conversation, doc, don't prescribe this because, lab tests have shown that I am resistant to this. So that is one way that you can help. Then there are other ways that we can prevent or reduce our exposure to antimicrobial resistance, such as a cough and our sneezes. You cover your cough and you sneeze, and then you would wipe, and then you would discard, but you would not just throw that on the ground, because then everything would get in the air. You discard that properly. You also practice hand hygiene to reduce picking up microbes from the bathroom, even from, hi Tasha, good morning, because it's a fascinating thing as to how resistance spread. Because let's say you are resistant to Bactrim, and I am not resistant to Bactrim, but because you and I are mingling all the time, because we have microbes on our body, it is part of our makeup. So when we handshake, we are exchanging microbes. Yes. We have microbes on our skin, and that is why you would see pimples come up and so forth. That's a little thing going on with us. Okay? So, like I said, when we do handshakes, when you go to the gym and your teacher is there holding you to put you in a position and telling you, we are exchanging microbes all the time. When we're in office and we are high-fiving, even in school with the children playing. In church, when we are holding to our microphones and so forth, microbes are passing between us all the time. When we're in an airport and we are moving on the the escalator that goes and we are holding on, we are picking up things that we do not know because we can't see these things. So it is important for us to practice proper hand hygiene, because then you may forget, and the next thing you know, you're eating, you're wiping your eyes, you're wiping your nose, you're putting your hand in your face, fixing your hair, and the microbes are just spreading all over, because microbes don't respect borders. They don't respect a country that is rich or a country that is poor. They don't respect rich people, poor people. There's no respect where microbes are concerned. And although there is resistance, what they are going to try to do to survive is to ensure that they can overcome that resistance. Because it's all about survival.
Definitely. And I'm glad you broke it down like that. For years I've always been thinking that, your hands, are the most nastiest part of your body. I've always said that. And you basically just reinforce, my line of thinking, because, we do intermingle. We do, your hands basically is the key to the outside world.
Right, the computer,
everything.
Your keyboard.
Everything.
And we do it in the office. Yeah. Somebody has a problem. Hey, come, you help. And we go over to the computer and we don't think about these things.
Yeah.
So COVID taught us a lot. And
it seems like after COVID, when everybody bakes, you don't really see people sanitize. You may see the occasional mask from time to time, but that sanitizer went straight out the door.
Back to basics.
Yeah, basically. But I just kind of wanted to revisit a bit back with the doctors and, prescriptions and, the role that they play in ensuring that we don't be resistant. Because I know from my experience, a lot of times you go to the doctor and they don't even take the first test, but they're prescribing you stuff. So they wouldn't know basically what you're resistant to, or if you're resistant to anything, if they're not testing you before they're prescribing you, some of these medications. So what education or what continuing education are you having, with doctors and persons in this position to ensure that they're doing their part to reduce antimicrobial resistance?
Well, we are always trying to enforce rational prescribing of medicines from the ministry's point of view. And once you enforce the theme of rational prescribing, it will encompass even antimicrobials. But what we have been discussing is to do an antimicrobial study, an antibiotic study of the use of antibiotics in the BVI, so that we can determine the rate of resistance in the BVI. Because when I worked at the hospital, there were 4 antibiotics that showed a high percentage of antimicrobial resistance in country. I am not there at this point, so I'm not sure how it has changed. But due to this study, we should be able to find out. And then, of course, following that would be a workshop pointing out the resistance, pointing out the pathway, and also what we can do. In our newly formed National Medicine and Therapeutics Committee, we should be developing what we call standards of treatment for infections. And if those are used and institutionalized, then we should see a reduction in any possible antimicrobial resistance, because we have the standard treatment guidelines, which doctors will be responsible for prescribing according to what they see. So I always encourage pharmacists, definitely do not dispense without a doctor's prescription, because we are not there sitting with the patient to know what their complaint is. Doing that can be more harmful than anything else. We also need to look at our vets, our pets, our food, the way we clean our houses, because of course there's animal to human transmission, human to animal transmission with the same resistance. Lots of us like to hold our pets. Some of us even like to kiss our pets on the mouth, which is not advisable, because then we transfer, just like how we transfer when we are kissing our partners, we are transferring those awesome microbes. Such a lovely act. but we are transferring microbes even in our intimate relationship with our partners. So that's how we get sexually transmitted diseases. So sexually transmitted diseases have also become resistant to some medicines that are used to treat them. So imagine if I am promiscuous, then I'm having sex with A, B, and C, and A, B, and C have just now gotten my antimicrobial resistant organism. And then when they have with their, you see the cycle. It's a vicious cycle in spreading.
So you are saying, am I understanding you? If I am resistant to
The
penicillin,
organism,
or the
the
organism,
organism
but
in your body,
not
not the person.
not the antimicrobials.
No, antimicrobials are the medicines.
Right.
Okay, you are not resistant as the person, Natasha. The microbes that are within Natasha's body, those are what become resistant.
Right. So if the microbes in my body is resistant to penicillin, right, and I have interactions with you, sexually, would you now be resistant to penicillin as well? That's my question.
Over time, it may happen, because if you weren't treated, all right, and everything under control, and we get the organisms under control, you will be giving me a little bit every time. Okay. So it's sort of like, and this is my pet peeve, when we buy dishwashing liquid with antibiotics, antimicrobials in them. Why are we putting that in dishwashing liquid?
In soup,
Because
in a lot of things.
what is happening is that the concentration of that antimicrobial in the dishwash is not of such a specific concentration to kill any bacteria on your hands while you're doing your dishes. So here you are, constantly giving your microbes on your hand a little bit of bacteria every time you're washing your dishes. So you're looking at that, possibly breakfast, you're washing your dishes after breakfast, lunch, and dinner. And these microbes are happily taking in this little bit of thing because it's not going to kill them. And they're getting happy and they're getting stronger. So when you know, after all these years of using Dawn dishwash, please forgive me for using, but that's what comes to my mind, Dawn dishwash with antibacterial in it, your microbes have become stronger and stronger. So when you go to the doctor, and the doctor now prescribes that similar antibiotic or antimicrobial, guess what? It's not going to work. Because you have exposed the microbes in you to that, and they have gotten stronger. Because remember, it's all about survival. It is not just us human big that you can see who want survival. It is also the microbes who want survival. You know. So I have a thing with dishwash that having antimicrobials in them. And when I go to the supermarket, if it is the last one on the shelf, the only one on the shelf, I am not picking it up. I have seen our detergents coming with it, and I'm not using those either.
And what about soaps? There
are soaps coming in it.
A lot.
There is an appropriate place for the use of hand wash with antimicrobial, and it's the hospital. There are a lot of germs there flying around. And because you're going from patient to patient to patient, you don't want to be taking happy-go-lucky Jack to Miss Jill, to Miss Francis, because in doing that, if you don't practice proper hygiene in the hospital, you're just spreading germs from one patient to the next, and then we wonder, and then, you would hear a doctor say, we don't want them in the hospital too long, for they might pick up a hospital-acquired infection. So we have to be careful as to how we are living. We go along and we live as if nothing else bothers us except our bank account, getting to our jobs on time. But there are some little things that actually impact our health, and we can't see how. But when we get sick, we are fussing because the doctors are not getting us well quick enough. But hand hygiene is important. And the use of these, like you say, are soaps. Once you have water and you have proper soap, it doesn't have to contain an antibacterial, because even in doing that, you're washing away the good bacteria that is supposed to keep you well as well.
Definitely, yeah. I've always been leery of those soaps. I I don't buy them. I don't buy the ones, the hand wash and what's not.
There's a place for them.
The you mentioned Dawn earlier, but was that just an example, or is that one for sure that has a lot of antimicrobes in it?
It's both.
It's both.
It's both.
Okay.
It's an
I'll
example
pay
because
attention, yeah.
I use Dawn dishwash. That's all I use.
That's a nice one.
But it have those that are without, and it have those I have seen on the shelves, some with antimicrobials in it as well.
Definitely look out for that.
So it's always good to read your labels when you go to the supermarket and just delve a bit below the surface.
I want to come back to something, but I want us to talk a bit about the impact. What's going on with the impact of AMR now and in the future if we don't get it under control?
I think I just explained the impact of how we can spread
Right.
AMR. So it can lead to increased lengthy hospitalization because I am getting sick, I have AMR. The doctors will have to continue testing until they find an antimicrobial that will make me better. So it lengthens my stay. Not only that, it impacts my finances because it's a longer hospital stay. The medication that may be required will be more expensive. So it lengthens your stay. And while you're doing that, there is job time off your job. So it impacts that as well. So it impacts your whole life. We may see that we may lose access to clean water because as individuals use the bathroom and we flush our toilets, these microbes go into our septic tanks. They go into the liquid that is running along our roads. So we can see our soil being impacted. And then when we plant, what happens with our food? So it's a vicious cycle. So you plant your trees. Because of the running waters, your trees get watered, yes, and they're coming up and rosy. But what is happening with the microbe that is there in the soil? And then we turn around and we eat that food. So antimicrobial can affect our farming. It can affect our animals that we may eventually kill for food because the microbes are still there in the goat. It's there in the cow. And when we kill them and we eat them, there are some microbes that don't die because of heat. Or pigs, they have a worm that doesn't die, although you cook it. We'll get to that another time. That's another. I love to be on your show. Or chicken. We need to look at these things. So therefore, how can it affect our life? It can actually shut down a nation if it gets that serious. In the future, if we do not get a reduction in AMR, how it will impact us medically. We will not be able to pre-treat a mom who's having a cesarean section to prevent an infection because we cut her open to take out the child. So the child may coming out in that process. We don't know how contamination can occur, and the child also now gets a whiff of antimicrobial resistance. We will not be able to do open heart surgery because all of these, you get preventative medicine before you have your operation. So you see where I'm going with this. We can't do hip replacements. We can't do open heart surgeries. Cesarean sections are at risk. What we would call normal treatment for like your appendix, if it ruptures, we have no bacteria, no antimicrobial to treat you. So what will we see? An increase in deaths, longer sicknesses, longer hospitalizations, longer time off the job. It's a bleak picture if AMR is not controlled now. And that is why we have to do, our theme is preventing antimicrobial resistance together. because it is a multi focus. It is not just me as a pharmacist, it is the doctor who's doing rational prescribing to make sure he prescribes the right medicine for the right microbe, for the right time, and the patient to make sure they take the medication as prescribed, not from someone down the street because they thought they had the same infection, not saving some for a later infection, because you need to take that medicine for the right time in order to make sure there aren't some little bugs there forming and getting stronger. Okay? So we need to practice hand hygiene. We need to ensure we keep our immune system strong, because then the immune system can ward off infections and so forth. We need to stop overworking ourselves and working on the brink, because then we're tired. We aren't taking the correct vitamins and supplements. We aren't getting sufficient rest to recover. So antimicrobial resistance can cripple us if it is not brought under control.
Definitely. Ladies and gentlemen, we've been here with our Chief of Drugs and Pharmaceutical Services, Mrs. Gracia Wheatley-Smith, here talking about antibiotics, antivirals, antifungals, antiparasitics. We're talking about, what you can do individually, what pharmacists, doctors can do, what our community can do collectively to ensure that this is not a problem for us here locally. We heard what the risks are. We heard what the potential impact can be. And she also gave you some pointers on what you could do to minimize your risk. Before we go, I just wanted to go back to something that you said earlier with regards to the proper cleaning of our homes. Give us a little bit of tips with that so we can ensure that we're cleaning our homes to minimize our risks even further.
Well, we just have to ensure that we clean, and when necessary, we sanitize. And I'll just go to the kitchen. For our cutting boards, you are cutting your meat, you're cutting your chicken, you're cutting everything on this cutting board. So you're using that cutting board to do so many things because it's convenient. It's keeping your countertop nice and clean. But then you're making those marks in it. And the blood from the meat or the chicken or the fish goes down there, and those microbes are there. If you don't clean that cutting board, ensure it is washed every time, then what is going to happen? Those little microbes are going to be there, and the next time you come and you try to slice something, they come up and they are right there in it. So that was just one instance. And the cutting board that you have for meats should not be the cutting board that you have for your vegetables. It should be a different cutting board because you don't want to transfer. It's all about cross-contamination and reducing it. Okay? In our homes, our garbage pans, most of us have the garbage there, and we may, in the interest of time, you're hurrying and preparing, and you may have your garbage bin, and whether you have your foot operator and you press it and your hand boots up, but somehow you've forgotten, you didn't think on disinfecting or cleaning your hands before you go back to your food or before you move out of the kitchen. So you're transferring microbes elsewhere in your homes. In your bathroom, what are you doing? Are you cleaning them regularly, especially taking care of your toilet? Are you doing that? Are you wiping them down after every use? I mean, some people might say, but this is taking up my time. But your health is at stake, because then you can be transferring. When you hold the doorknob to come out of the bathroom, did you remember that you had to wash your hands, dry your hands properly? Or did you just come from the toilet and get up, hold onto the knob, and you come out, and then you go and you touch your TV remote? Here we have microbes going all over your homes, and you are not the wisest. So we have to pay attention to what we do in our homes, because we can have microbes just going all over.
Wonderful, ladies and gentlemen. A very good, energetic, and very informative talk about antimicrobials and, how we can handle them with care. So before I let you go, would you like to make any final comments?
Yes. I myself have experienced a patient with antimicrobial resistance. And it was very difficult to treat that patient at the hospital. But this patient unfortunately fell into the hype of using antibacterial dishwashing liquid because commercials say it is safer, of using antibacterial soap because commercial is saying it is good to use. Nevertheless, nothing was given about the ugly side of using antimicrobials when it is not necessary. And so that patient got sick, and we struggled to find the right antimicrobial to treat that patient. And when we did, it was very expensive to the government and to the patient because eventually upon discharge they had to pay the bill. So we need to be careful because misuse and abuse of antimicrobials can actually result in a hard time for us financially, and if not controlled, can result in our death.
Once again, ladies and gentlemen, you've been tuned into Health Bytes, and today's topic was antimicrobials and antimicrobial resistance. We have with us our Chief of Drugs and Pharmaceutical Services, Mrs. Gracia Wheatley-Smith, who shared a wealth of information. And for persons who may want further information, leave us with your contact number.
My contact number is 468-9850. This morning, as I was reviewing for this, the statistics for the U.S. was 35,000 deaths per year is attributed to antimicrobial resistance. So we need to be careful.
Need to be careful. Significant impact, potential impact, a lot of great things that you need to know to minimize your risk. And of course, if you have further information, if you need further information, feel free to contact our Chief of Drugs, 468-9850. Reporting for the Ministry of Health and Social Development, I am Public Health Communications Specialist Natasha Letsom Humphrey. Thank you for tuning in, and please share the information.